Good afternoon, everyone. I'm Dr. Olubunmi Akinrade-Bello, and I'm a consultant ophthalmologist with St. Emmanuel Hospital. So as part of the 50th anniversary celebration of the hospital, we're doing a series of health talks. So this afternoon, I'll be talking to you about taking care of the eyes. And so I'll be presenting it according to this outline. Just a minute. Yeah, so as an introduction, I cannot overestimate the importance of our vision. Our vision is the most dominant of all our senses, and it plays a critical role in the growth and development of an individual, especially children, and even in creating, it plays a big role in the work opportunities, school opportunities that we're exposed to. And of course, it's through our vision, it's through the sense of sight that we're able to socialize and relate with friends, families, and our community, and generally know what's going on. So it's the most dominant of all our senses. So as a brief epidemiology, it's been found out that about 2.2 billion people worldwide are visually impaired. And when I say visually impaired, I mean they have an eye condition that causes a reduction in their visual function. And it's been found out that at least half of these conditions could have been avoided. It's either it could have been prevented or it could have been treated. So globally, the leading causes of visual impairment is uncorrected refractive errors, cataracts, diabetic retinopathy, glaucoma, and age-related macular degeneration. Now, according to the Nigerian National Blindness and Visual Impairment Survey carried out some years ago in Nigeria, the prevalence of blindness, that is people that have lost their visual function completely, was 4.2%. And it was found out that 84% of this was avoidable. So compared to the global causes of visual impairment and blindness worldwide, really, there isn't much of a difference. The only difference is that we have, in addition in Nigeria, corneal scarring and pterygium. Corneal scarring is when the glass part of the eye becomes white, thereby affecting the patient's vision. So I'm going to share some steps on how we can take care of our eyes. And now a lot of the steps are steps that you're probably familiar with. So essentially this talk is to re-emphasize these steps that we all know. And in case you've never heard of these steps, then you're in for a treat today. So the first, if there's anything I want everybody to take from this talk, the most important step as far as I'm concerned is the need to go for routine eye checks. And the point of this is that a lot of the eye conditions that can lead to blindness, some of them can be silent. So you won't know unless you go to the doctor, to an eye specialist to get your eyes checked. And it is recommended for adults to have their eyes checked at least every 1 to 2 years. Now, we also have, for children are also recommended to get eye checks within the newborn period, within the first 72 hours of life. At least the newborn's eyes should be checked. Then within the first year, while the child is an infant, it's also recommended that the child gets the eye checked. Then before the child starts school, and even after the child starts school. So ideally, the eyes should be checked annually or biannually. So this is the most important tip I would want us to take from today's talk: the need to go for regular eye checks. The second thing is for us to know our family history, and it's very important because there are certain eye conditions, for glaucoma, for example, that runs in families. Like if an individual has a sibling that has glaucoma, that person's risk of getting glaucoma is 4 times that of the normal population. And if the individual has a parent with glaucoma, that individual's risk of getting glaucoma is 2 times that of the normal population. So it's very important to know your family history. And then glaucoma is not the only eye condition that is related, that is familial. You also have things like age-related macular degeneration that could be familial as well, and some certain types of cataracts that could be familial. Then besides knowing your family history, you also want to know the your predisposing risk factors. So predisposing risk factors would medicines that we call steroids. You need to check your eyes even more frequently. Step I'm going to talk about is protection for the eyes. Now, in this part of the world, we tend to look at wearing sunglasses as just a fashionable thing. But really, it helps to protect the eyes a lot, because the sun, we have ultraviolet radiation from the sun. This ultraviolet radiation increases your risk of getting cataracts. It increases your risk of getting age-related macular degeneration. It even increases the risk of getting ocular surface disorders like pterygium. That is a fleshy growth on the eye. So it's important to use sunglasses that can protect your eyes from the sun. So it's not just a fashionable thing. And then you can see that I have a pair of I have a picture of a protective goggles here, especially for people that are in jobs that work with projectiles, meaning like if you're a carpenter, for example, or you don't even have to be a carpenter, if you're doing projects at home and you're hammering, the risk of the nail getting into your eyes is high. So it's important for you to use your protective goggles. Then especially for those of us that take okadas, motorbikes, what we call okadas in Lagos. I mean, going at such speeds, dust particles can get into your eyes and cause harm. So it's always important to either have your sunglasses or get something to protect your eyes. Now, we also need to protect our eyes from our screens. Now, we can't get away from these screens. I'm doing this presentation from a laptop, and it's part of us now. But there's a need for us to minimize the strain we get from our screens. So this 20-20-20 rule emphasizes the fact that when you have been working on your screens for a long